So now we see types of dialysis. There is two types. Dialysis is a medical treatment used to remove waste products and excess fluid from the blood when kidneys fail to function normally. There are two major types: hemodialysis and peritoneal dialysis. Hemodialysis denote HD and peritoneal dialysis denote PD. A newer category includes continuous renal replacement therapy (CRRTT), means continuous renal replacement therapy for critically ill patients. First, see one by one. Hemodialysis. In hemodialysis, blood is removed from the body and filtered through a machine called a hemodialyzer, means artificial kidney, before returning to the blood. Procedure: blood is taken through vascular access, AV fistula or catheter, pass through dialyzer where diffusion and ultrafiltration occur. Clean blood returns to patient. Frequency of hemodialyzers: usually 2 to 3 times per week, each session lasting 3 to 5 hours. Merits of hemodialysis means disadvantages. Very effective. Merits means advantages, not a disadvantages. Merits: very effective in removing small solutes, toxins, and excess fluids. Treatment is performed under supervision by trained professionals. Patients does not need to perform the procedure themselves. Suitable for patients unable to manage home-based care. Demerits means disadvantages of hemodialysis. Requires frequent visits to a dialysis center, means 2 to 3 times per week, and it is a long lasting procedure, means 3 to 5 hours it takes. Needle insertion each session, painful for some patients. Risk of infection, low blood pressure, clotting, muscle cramps. For preventing clotting, we use a heparin solutions. Dietary and fluid restrictions required, not portable, except newer portable machines. Second types of dialysis: peritoneal dialysis. Use the body's own peritoneal membrane, lining of abdomen, as a natural filter. Procedure: a dialysis solution, means dialysate, is infused into the abdominal cavity. Waste products pass from blood vessels in peritoneum to dialysate. Dialysate is later drained and replaced, means changing the dialysate. Types of peritoneal dialysis: there is two types, subtypes. CAPD means continuous ambulatory peritoneal dialysis or automated peritoneal dialysis. CAPD or APD. Okay. In CAPD, continuous ambulatory peritoneal dialysis, manual exchange 3 to 4 times per day, no machine required. Means manually we change. Automated peritoneal dialysis, machine controlled while patient sleeps, means it's a automatic based on the machine. Merits of a peritoneal dialysis: can be done at home, promotes independence, means it's easy process for dialysis. More gentle and continuous, better blood pressure stability, no repeated needle use, suitable for children and elderly patients. Demerits of peritoneal dialysis: risk of peritonitis, means infection in abdominal cavity, may cause hernia, means accumulation of fluid in the testis, or abdominal discomfort. Not suitable for patients with abdominal surgeries or obesity. Requires daily self care and strict hygiene. May not be effective in severe kidney failure. Okay, these are the some demerits. Because of kidney failure, we don't use. And next one is a continuous renal replacement therapy. These are the new modern techniques for dialysis. Used in ICU. ICU means intensive care unit. Okay. Used for critically ill patients who cannot tolerate rapid blood removal. So that's why we use continuous renal replacement therapy. They includes again three subtypes like continuous veno-venous hemofiltration, continuous veno-venous hemodialysis, continuous veno-venous hemodiafiltration. Okay. Uh, Only remain three words: hemofiltration, hemodialysis, hemodiafiltration. First one is a filtration, dialysis, diafiltration. Merits of continuous renal replacement therapy. Renal replacement therapy: Gentle and continuous fluid removal, better tolerated by unstable or ICU patients, maintains better hemodynamic stability. Some demerits of CR continuous renal theory replacement therapy requires intensive monitoring, expensive, not suitable for home use. Okay, these are the some uh, dialysis techniques. Comparison table in which we see feature hemodialysis means durations and where it's peritoneal dialysis CRTT. Okay, location of hemodialysis hospital or clinic, peritoneal dialysis home or CRRT ICU. Frequency of hemodialysis 2 to 3 week. Peritoneal dialysis daily because it is a easy process, homemade process. In CRRT, it's a continuous process. Best for hemodialysis stable patients, peritoneal dialysis for independent patients, and CRRT for critically ill patients. Risk of hemodialysis hypotension, infection. Risk of peritoneal dialysis peritonitis, and a risk of continuous renal replacement therapy, bleeding and infection. Conclusions: dialysis is life saving therapy that compensates for loss of kidney function. The choice depends on the patient's medical condition, lifestyle, age, and access to medical facilities.